Hey everybody, Dr. Joe again. Today I'd like to talk to you a little bit about who is the best candidate to come in for veterinary medical manipulation. Like I said in a previous video, I typically see geriatric patients all day long in my acupuncture practice. They're who do the best with acupuncture. But that isn't necessarily who is going to do the best with VMM or veterinary medical manipulation. I have an older girl at home who's 14 and a half. And while I can adjust her neck quite well, and she seems to actually enjoy it, as soon as I get to her thoracic and lumbar spine where she has a lot of arthritis, she really doesn't care for it. So I have to use different techniques for her. Instead of using the high velocity, low amplitude thrusts that I would use in her neck, I actually do a little bit of traction and I just hold those joints at tension to try and stretch it versus try and manipulate it quickly back into a normal position or to remove the restriction. I just hold it instead. So while geriatrics can benefit greatly from veterinary medical manipulation, I'm slightly limited in what I can and cannot do with them depending on their arthritis or depending on what other injuries they've had over their lifetime. Now I have a 2.5-year-old at home and he has had no major injuries. He's not been hit by a car. He's had no orthopedic surgeries. He's had no major orthopedic injuries in his lifetime. But yet he is kind of the perfect candidate for who would benefit the best from veterinary medical manipulation. I have found restrictions in his neck. I have found restrictions in his pelvis. And he's just kind of nuts. So he runs around like crazy. He has friends that he runs with. He tumbles. He flies off the back of my couch and lands on his front legs. He has run into my sliding glass door. He has done all sorts of things that a crazy 2-year-old lab is going to do. And therefore that has caused restrictions in him. And I could just wait until he has a problem and fix them at that point in time. But as we talked about in a previous video, these restrictions can cause problems within several days. They can start to cause adhesions in the joints, which then causes a lack of mobility, which then can cause a breakdown of cartilage. And so we really want to fix these restrictions as early as possible. So how do you know if your dog needs veterinary medical manipulation? How do you know you should bring them in for an exam? Abnormalities in their normal gait or how they walk. Do you notice, are they turning their feet out, turning their feet in? Do they kind of flip their leg out to the side when they walk, circumvent it when they walk, versus walking straight? Do they keep their feet narrow underneath them? Are they keeping their feet wide based, that they're trying to balance a little bit better? Do they not jump on furniture like they used to? Do they not jump off of furniture like they used to? Especially our sporting dogs, if you are doing agility or flyball or lure coursing or fast cat, is their time slower than it used to be? Are they having difficulty with different obstacles? Popping out of weaves? Are they not putting their feet on the contact positions on the A-frame? Are they dropping bars? Are they having any difficulty that is new to them? That would be a good indication that there could be restrictions and that you would want to have them come in for an appointment. Again, this is not to say that your geriatric dog cannot come in for an appointment. I do think that they could benefit. It just depends on how tolerant they are of the procedure. Like I said, it also may look a little different when they come in versus when a younger dog comes in. It doesn't mean that I cannot help them. It just means that I'm going to have to vary how I do things and maybe adjust and modify what you may think of in your head as to what I should be doing to make it what's best for your dog. So we also can do cats. That's also something that I don't think I've mentioned in any of these videos, is that I can adjust kitties. So if you have a kitty that you notice has stop jumping off of furniture, stop jumping up onto furniture, is not going to the top of its cat tree like it used to, those are also indications that they may have restrictions and they may benefit from veterinary medical manipulation. The other thing too is we haven't quite decided how we're going to schedule these appointments, but it could be something that we schedule time that if the VMM doesn't seem like it's the best option for your pet, we could instead do therapeutic laser or acupuncture treatment instead. So stay tuned. We're working through this progress and trying to figure out how to best serve you and how to best offer this to the public. And I'm really looking forward to it. Thanks, guys.